Set. Keeping someone comfortable and reassuring them is something that you can do. You expect them to have a lot of pain. Expect them to need a lot of support. You, of course, are always going to be keeping their airway clear. Late in cancer, there's a lot of fatigue. They're very short of breath because they don't have the same amount of lung tissue. Okay? To absorb oxygen. You guys know this question, which of the following is the most common surgery for an apparently curable tumor of the lung? It's a lobectomy. It's the whole, take out the whole lobe. That lobe of the lung. Right side has 3, left has 2, right? Got to talk about trauma for just a minute. What's blunt trauma? What's one of the most common causes of blunt trauma in this country?
Car accident.
Steering wheel, car accident, steering wheel. Okay? So with that kind of blunt trauma, you can get fractures of the sternum, fractures of the ribs, and you get this thing called flail chest. That's what flail chest is.
The ribs come off the sternum.
When you do see
All the ribs come off the sternum.
Right, exactly. Well, what happens? Normally when you inspire, you have expansion, right? Okay. With flail chest, instead of having an even inspiration, you've got this piece kind of falls in, and it releases flails. And it can be one side, unilateral or bilateral. And so instead of having an even expansion, contraction with respirations, because remember that the rib cage helps keep the pleural cavity intact, and it's not intact anymore, and you just have this piece of the lung or side of the chest that flails, and it's very, very painful. Pulmonary contusion is you just have a bruised lung, and you can have so much chest trauma that you perhaps don't break a rib, but the lung is actually bruised. And a bruise in the lung is like a bruise anyplace else. What is a bruise? Broken blood vessels, and blood seeps into the tissue, and with the blood seeping into the tissue are all the factors that help the body heal. So you have an inflammatory response, and anytime you have an inflammatory response, you've got pain. Have y'all talked? Did Mr. Mills talk to you guys about pneumothoraxes? That's basically a collapsed lung. Sometimes, for reasons we don't understand, air leaks from the lung into that negative space. And once it leaks in, there's a ruptured alveoli, or tumor can happen with the tumor. It happens from the inside. Air leaks into that space, and once that negative pressure changes, the lung collapses. Atelectasis, there's no air leaking into the pleural space. This is when there's air in the pleural space.
So is that what they call open air sucking wounds or something like that?
Open air sucking wounds are when you have a penetrating wound from the outside. Okay? You can have a pneumothorax without having a sucking chest wound.
Okay.
But a sucking chest wound does suck. It's like, okay? I have a couple of good slides in here. And you can also have a tension pneumothorax, which is the change in the pressure. But look at flail chest. See what happens? It's not even and symmetrical. I don't expect you as entry-level nurses to be able to differentiate if I give you a picture of these various pneumothoraces. This is an FYI, so you sort of understand what's happening with the pneumothorax is the lung is going to collapse. And so you may be using a chest tube.
Can
Yes.
this happen when someone has an asthma attack?
I don't know.
I think I had a nephew, and I think this happened. He had real bad asthma.
And he
They
got,
said his lung had collapsed. So
I don't know, but sometimes athletes, especially males, will have spontaneous pneumothorax. The lung just collapses.
He was actually outside doing sports. So.
Did he survive? Good. And of course, if you puncture the lung from the outside, the lung can collapse. You put chest tubes in for heart surgery, will collapse the lung. We have to re-expand it, we re-expand it with chest tubes. We'll be talking about modalities more on Thursday, okay? Oh, this, I like this question. Nope, okay. Is the following statement true or false? An initial characteristic symptom of a simple pneumothorax is the sudden onset of chest pain. Okay, we
When
need
they're
to,
breathing, maybe you say something, like, is it gonna be shallow?
you're not gonna hear lung sounds on one side, are you? When it's pain, you don't hear
Shallow
it.
breathing?
Well, you don't hear it, it depends on how much, if they're having shallow breathing from the other side, it's because they're in so much pain and not breathing well. But you're not gonna hear any lung sounds. Nothing. Okay, we need to do a little bit of pharmacology before Mr. Mills gets here.